I do have a quote here for access control at our building. That is to put locks on the doors into the building, the office doors, and then the narcotic cabinets. And also there's individual locks for the ambulances as well that will run off the same system. So it basically will lock everything down. We can do this with either the ID badges, there's also apps on their phones they can use, and we can also just put stickers on there. So like the hospital nurses that have hospital ID badges, we can give them a sticker that they put on the back of that would give them access. So off of those. It's the same like the courthouse has. It's all ran through a computer system, so you give people access to certain doors and you can lock that down.
Well, what do we do with the Bird City one? It's all one open building.
Yes. So, but we don't store stuff like that over there.
Oh, okay.
And the ambulances themselves will have locks. So inside the ambulance, what's in the ambulances over there will be locked. The building itself will not be locked. But
The ambulance, you're saying the narcotics box will be locked, not the ambulance?
no, right. You would have to have the credentials to get into that box, even on the Bird City
okay.
ambulances. But there's not, we don't really have anything controlled in that building. So the reason it's the St. Francis building is that's where all the inventory is.
Okay.
So, and I will be meeting with the AEMTs to kind of go over, the future plans as far as how much we need to keep on hand and what they want to do. And so this will be kind of tailored to that. But this price would cover everything. We may not end up doing all of it.
Okay, are you looking at the $260 per month?
Yes.
Minus the optional fees, right?
Okay, so down below, those are fees like the mobile user is if they want to put it on their phone. Like they can put the QR code on their phone to get into the box.
Well, I say if somebody wants to do that, they
Right. They just put those on there. So what I'm looking at is the 260.
260.
Mm-hmm. And part of the reason it's a reduced cost too is we already have the system itself, so this is just adding on to it.
So this will purchase everything?
Mm-hmm.
So do we basically lease it from them?
Yeah.
Yeah,
Basically.
it said right there,
Okay.
It's just a monthly ad fee for it.
it says Nextech Security owns and maintains the system for life.
Yep.
And Ryan, do you want to explain a little bit more in regards to the necessity of this, how it's going to work, and how it's going to be more efficient in regards to what is in place now?
Yeah. So currently we just have the cameras. Basically is how we would have to go back. If there's an issue, we review the camera footage to go back and see who's been in and out of there.
No,
We don't have any logs or anything because it's just a keyed system.
Right.
So this would actually keep track of every door they went in and out, where they had access to.
so now we have no way to track who comes and goes. But with the new system, we would have.
Correct. We'll know every time somebody goes in and out of a door, every time they get in and out of a cabinet, whatever.
Yeah.
What this does, it also protects, if we should have an issue, it quickly eliminates a lot of people, if that makes. It's
It
for
does.
everybody's protection as well, and our own protection.
Yeah.
So. And we can, so the EMTs that can't access drug cabinets, their cards will get them in the doors, but they won't have access to what they can't have access to.
Makes
So,
sense.
the offices and the records, we can select who has access to those. And it's a keystroke in a computer. So.
And even if, say, if a person had access before, you can eliminate them.
Yep,
And they're no longer allowed in there.
correct. Yep.
On any computer in here, in the EMT office or at home or anywhere else.
Well, it doesn't have anything to do with the computer programs themselves. This is an actual physical card, like to get in the doors. So, but yeah, if somebody all of a sudden didn't need access to the office anymore, you just go in and change it, and then their card wouldn't work at that door anymore. So. With the technology that is available nowadays, I think this is, for everybody's own protection, this is the way to go. So.
I agree.
You got it within your budget then to take care of it.
Looking for a motion to go ahead and accept Next Tech Solutions bid for a security system for the EMS buildings and ambulances.
I'll make the motion to accept them.
Second.
Okay, all those in favor? Aye. And I should have said that is a monthly cost of $260.
Sorry.
You're fine.
In the future, we will have more detailed reports as things get going, but I did just want to kind of quickly print off this. This is showing our call volume for August, September, and October. The EMTs should be praised. They've had a lot of calls in the last 3 months. I just did a quick percentage there, and as you can see, just the last 3 months is 43% of the total yearly call volume so far. So almost half the calls have happened in the last 3 months.
Well,
So,
I'm just glad you have a bigger
yes.
Bigger
Yes.
workforce.
So
now.
I just kind of wanted to let you guys know the stats. Also, a big thing is recently we've started taking long distance transfers. So
Good.
we've had, Jill told me 9 of those here lately. So part of that is, having the 2 full-time staff up there.
Yeah.
They can either go and somebody else can pick up the call for them to leave, or vice versa, and they can work that out. So that has helped with that as well.
Well, and we knew that was going to happen, so
Right.
that's positive.
Yep. The billing is getting squared away. It's changing daily. They've gotten about 60 to 80 claims out so far, so I would anticipate there's going to be some big deposits coming back into the county. Our goal is to have a lot of this at least put out by the end of the year. So the end of the year, and the way the calendar year works is kind of tricky when it comes to billing, because we're going to end up with money coming in 2020 that was actually 2019 revenue, so it gets really tricky there. But we're trying to get as much as that wrapped up by the end of the year as we can. The call schedule remains covered. We haven't had any deficiencies there. Dr. Lick has reviewed our narcotics and our policies. She has made some suggestions, and so we will be making those changes accordingly. I did also want to mention our tower behind our building, our radio tower. We've got an antenna issue going on. I'm not sure the extent of that, so Vance from Next Tech will be coming out to take a look at that, but we will be having to get that fixed. So I don't know what has happened, but all of a sudden, we don't hear Goodland or surrounding county traffic, which for me, covering 3 counties is kind of a necessity. So it has to do with our tower out back. So.
But it's not affecting anything locally.
No, because Cheyenne County runs on the 800
Right.
tower, so we're still good there.
Okay.
It's basically monitoring our surrounding counties, but also I have UHF at my office, to set off the tornado sirens and stuff if something would happen in dispatch as a backup. So that's one of the reasons we got to get it fixed. So. Okay.
All right.
Any other questions for me?
No, Ryan, I think these guys agree. You're doing a fantastic job. It was a big job to take on, and you guys need to be praised for it.
Don't let it go to your head.
Yeah, we don't give compliments very
No,
easily.
it is.
No.
Tabitha and Jill have helped out immensely through this process. So.
It's nice getting monthly bills turned in on time and
Yeah,
easy to work with.
And I will say Jill is also, she likes to pinch pennies, which I like.
Right.
So she's very, she really thinks things through before she comes and says, we need to order this. We have a Philips monitor up there. She got it serviced and put back into service, which is like a Zoll.
Yeah.
So that's preventing us from right now spending the $50,000 on a new Zoll. So
Good for her.
stuff like that. So I really do appreciate both of them. So.
Good deal. All right, thank you, Ryan.
Just when you think you've heard it all.
Good morning.
Morning, Teresa.
How's everyone?
Good.
Good. I'm spooky. I should have brought some of the kids back with me.
Did they did in the grade school.
Yeah, it's cold out there. Oof. So I'm here this morning to present the documents for the transportation grant. It's that time of year to apply for our federal and state funding through KDOT. So I guess if you approve it, then I will have you sign what I need signed, and I'll get it submitted. I've gotten all of our supporting docs from all of the local agencies, Bird City Area on Aging, Senior Life Solutions. I had Cheyenne County Village write something, and then a number of patrons or people that ride city sent their funding statements. So I have a letter that just authorizes that Terry's the chairman and authorizes myself and Scott to apply for the grant. I need everybody to sign that. And then this is the funding letter that we show the budgeted amount that you set aside for transportation or for the grant. And then a bunch of other certificate stuff that Terry, as chairman, will sign. You guys have any questions about the van and what's been happening? I think Scott's been filling me in on riders, so.
Yeah, and Tony is
Yep.
on the job.
She's started and
Yep, we're still looking to try to get her to an actual class, but as soon as this one comes up, then we can do that. So we can switch her here. Terry, I don't have a mark, but there's a number of places
Okay.
that you'll need to sign in this lovely packet, so.
Okay, do I hear a motion to go ahead and approve Sharissa and Scott to move forward with this grant application?
I so moved.
No, second.
All those in favor? Aye.
What's that?
Go ahead, Terry. Pass it down to Roger. That needs to go down. Okay. I think there's two places on that one, and then one on this one. Just where the lines are above your name there. Thank you.
And I'd like to commend Sharissa for doing this. This is a lot of paperwork she has to put.
Okay,
through,
and then
and,
this one.
saves the county money by her doing it.
I get a lot of compliments on the van.
Yeah.
It's good.
There.
Good grief.
There's a lot.
Hope no one comes looking for me over this.
Okay, that's not, I think there's a couple more there. And there again.
Probably should have read these.
On the back, one more. I think this one just tells us that we're involved in the number 8, our Northwest Kansas Transit Council. Sign that one.
So how much is the grant for?
It's the same amount that we've done. I don't know if I have my funding with me. Ends up being overall like 60,000, I think, close to that when we apply. We still get 50% from federal, and then still the 20 currently from the state if all goes through. So somewhere on there. And last page, I think. That's the part that says that we participate in the drug and alcohol program, and
Okay.
just all the programs that we have to have in order to comply with KDOT
Well,
certificates and
Obviously,
assurances.
the van's being well used, so.
It has gained more local rides. It's kind of funny. We thought when the village or the assisted living opened, we were going to lose all of our riders, but yet instead of them going to the senior center, now they all go to salon services or to the Dollar General or they go down to senior center to play cards, or they still do things in the community. So we've actually increased riders than what we had due to those things. So, and we pick up additional riders here and there, and people that maybe have had knee replacements and have to go to therapy. We still do a lot to physical therapy and doctor's appointments, of course. So it would be nice to be able to eventually maybe add a van to go to out of town so we can take people to Colby or Goodland for doctor's appointments, because the demand response for in town is so great that it's really hard to
Ties it up,
schedule
yeah.
2 to 3 hours, because you really don't know how long you're going to be waiting in Goodland for a specialty clinic or something like that.
It's almost impossible. We can get to Goodland sometimes, but that's about it.
Yeah.
Do we have enough drivers now?
Yeah, we're back up to 3. We have that 4th one, Robin, if we need her, she would still be available, but we did find the other part-time, so we're back up to 3 part-time, full-time, you know what I mean?
We have one person that does one day, 2 others do
They still do the
days.
2 other days, so we still got one that's kind of going through some health things, so that's why we've now got the other one, so hopefully it'll all get done and be okay, and we'll be back into good health. So
Thank you for managing this.
Nope, thank you.
We appreciate it.
Have a happy Halloween.
I don't know how much money they're thinking about bringing in for the ambulances on all these buildings.
I haven't heard a dollar figure in regards